Good afternoon, everyone. Welcome to Cancer Reach. Cancer Reach is initiated by Dr. Krishnamani to spread awareness about the cancer and help the caregivers and patient to access the right treatment on right time. So today, Doctor, we are very honored to have our distinguished speaker for today's live session on World Cancer Awareness by Dr. Krishnamani. As you all know, February month is a World Cancer Awareness Month. And here we have got a wonderful opportunity to spread the awareness with our renowned expert who has treated different types of cancer, Dr. Krishnamani. Dr. Krishnamani has exceptional track record in research, patient care, and advocacy. So I would request Dr. Krishnamani to just give some opening insights. So I extend a warm welcome to Dr. Krishnamani.
Thank you very much. Good afternoon, everyone, and welcome to Cancer Reach. As we always start off saying that Cancer Reach is an initiative from all of us to spread awareness about cancer. And February 4th is World Cancer Day. So this is our session which we have every Friday. So we didn't want to miss this opportunity. So day after tomorrow is World Cancer Day. And the theme for this year is Close the Care Gap. So every year there is a theme on World Cancer Day. So World Cancer Day is held on February 4th by the UICC, Union International for Control for Cancer. That's an organization which works in cancer care. And this year the theme is Close the Care Gap. So what does this mean? We have to close the gap in cancer care. So there are places, there are populations, there are countries where the care is exceptional. Patients get the best or optimal kind of care, but there are populations where the care is at a very bare minimum level. So we have to close this gap. That's the motto for this year.
Wow, doctor, thank you very much. Actually, doctor, we done many videos in that we have discussed specific cancer, but this knowing about a cancer itself will be a very exciting session, doctor. So without any further delay, doctor, let's begin the session, doctor. So just to know, doctor, what exactly a World Cancer Day is?
So as I just told you, we have it on February 4th every year by the UICC. And why do we need to have a World Cancer Day? So the UICC aims that there are, the UICC, or all of us know for that matter, that there are so many patients who are suffering with cancer. And cancer is a deadly disease. But we also know that we can prevent cancer, we can cure cancer. There are a lot of strategies in the battle against cancer. So it is not like 50 years back or 100 years back where our knowledge was very limited. Today we know that there are vaccines for cancer, we can prevent, we have screening tests, and what are the risk factors for certain cancers, what are certain good cancers, certain bad cancers, etc. So the whole point is this World Cancer Day should be a moment where we galvanize people, families, advocacy groups, NGOs, support systems, including governments, where all these organizations work for the betterment of cancer care and for uplifting patients who are suffering with cancer so that they get better and we prevent a good amount of cancers and we cure as many cancers as possible. So that is the whole motto for this World Cancer Day, and that is why we are all working towards it. But more importantly, let's understand that it is not a one-day affair. Okay, there'll be a lot of media blitz. There'll be a lot of celebrities who will come and talk. We should not think that cancer also considers February 4th as World Cancer Day, and that day it is going to listen to us. And after that, once we stop talking, cancer also will stop. No, this is an ongoing effort. This is a continuous, persistent effort from all of us, all caregivers. But this day is to highlight. So this is not the only day in the calendar, but it is one of the important days in the calendar.
So, doctor, as you rightly said, not only on 4th February, in fact, 300 remaining 364 days also, everybody should be aware about the cancer. That's a very important message, doctor. So what is the then what is commonly seen with cancer, doctor? Like commonly seen cancer?
So before that, a very brief introduction on what cancer is. Okay. So for the benefit of people, uh, what is cancer? Cancer is an unregulated growth of cells, okay, which has a tendency to spread.
Mhm.
Very simple. Let us be in layman terms what we talk about cancer. So in the human body, there is always growth, and when there is growth happening, there is destruction also.
Mhm.
Okay. So simple example. If anything grows beyond a point, it will look big, or it's called overgrowth. Okay.
Mhm.
So the word cancer by nature means a cell is growing, and the factors or the forces to prevent that growth in the body, there is always a something which promotes growth, something which prevents growth, and they are working together in tandem in the same force so that it is in the balance. Now when the growth is higher, it means either something is driving the growth, or
Mhm.
what is preventing that growth, those factors are coming down. So when there is a problem in this, it's a seesaw. When something is up and something is down, that's when cancer cells start growing. So when the growth factors are increasing, or the inhibitors we say, or the things which prevent cancer are decreasing, cancer growth happens. And once the cells grow beyond a point, they have a chance to spread, or in medical language, metastasize, spread to different organs. So when that happens, we call it cancer. So that is technically the word cancer, which is derived from the word which signifies crab.
Mhm.
Okay. And now, when you asked about the common cancers, blindly world over, in India specific to lung cancer, breast cancer, cervical cancer, prostate, intestinal or colorectal cancer, stomach cancers are the commonest cancers. When you talk of cancers common, we again, if you segregate in men versus women, in men lung cancers are common, in women breast cancers are common. In India, if you say, we have discussed this before, the number one cancer in women is breast, and number two is cervical cancer. But overall, lung, breast, cervix, colorectal, prostate, these are the cancers we commonly see.
Actually, doctor rightly said that many cancers are there, for which actually specifically many videos we have done on many of the other cancers. But rightly said, there are so many cancers available in the market. No, people generally tends to get confused which is what and what is which. So that's very well explained, doctor. Doctor, like which type of cancers have been giving a best result or treatment?
So, why we are addressing this question is, when you talk about cancer for a layman, the first word which comes into their mind is fear and death. Okay.
Yes.
So, the minute you say cancer, the next question which comes is, what is my stage? Oh, I have got cancer. Oh, I'm going to die. My children will become orphans. Okay. If it's a father or if it's a mother, that is what goes on in their mind. Let us understand. So, many cancers are curable. Many cancers are preventable. The best examples of highly curable cancers are lymphomas, germ cell tumors, which are the tumors which develop in reproductive organs like testis or ovary, early stage breast cancers, a type of tumor called choriocarcinomas, which occurs in women. So these are all highly curable malignancies. Okay, but the minute we say cancer, it's death or it's a fear. So when we think about now, breast cancer is a very common cancer, highly curable. Childhood leukemia, which is called ALL, acute lymphoblastic leukemia. The cure rate in children is more than 95%. So, child who develops blood cancer, the parents would get aggrieved and anxious, but they should understand that there is hope if the right treatment is taken in the right way. CML, chronic myeloid leukemia, is a type of blood cancer. 20 years back, people used to take all kinds of medicines and they used to progress within 4 or 5 years. Today, you have one tablet called imatinib or nilotinib or dasatinib, which specifically targets there is a mutation one chromosome and another chromosome, they get attached, or there is some translocation, we call it, since some things from 9 go to 22 and vice versa, that type. So basically, because of a genetic mutation which is called 922, there is this extra growth of cells. Now you are targeting it with one tablet, which you will take once a day at home. And now CML patients live for 20 years, 15 years.
Wow.
Many of them don't need transplant. So this is the way the science has evolved. So cancer no more means death. So the most highly curable cancers are early breast, lymphomas, Hodgkin's disease or non-Hodgkin's lymphomas, and germ cell tumors of the testis, and ALL in children.
Actually, sir, rightly what you said. Generally, whenever the patient come across that I am having cancer, he will already be half dead from inside that, oh, I have a cancer. So the motivation and the depression will be simultaneously kicking that patient. So is the
Correct.
family also. They will also be like half in a grief kind of a thing that, oh my God, somebody is from my family is with cancer. So that itself will kill the patient, I guess 20 to 30%.
Also, suppose you come with a negative mindset or you come with hearsay. I already think that, okay, my family member has got cancer. This fellow is anyway going to die. So there is no point.
Yes.
If it is a good cancer, you're losing the chance, and he loses the chance to live. And it is not expensive. You are not thinking of expense here, but you have already come to the conclusion that somebody is going to die or this cancer is not curable. Because you
Yes.
don't have the right knowledge, or nobody is there to guide you, or you are not
Mm.
going and seeking the guidance.
Hopefully, sir, this awareness will give everybody patient that there is a so many evolution drugs and techniques available to take care of the cancer patient. So death is now a far apart. So, doctor, like how to prevent cancer?
So when you talk about prevention, what are the causes of cancer? The causes are, as we always say, one, there is genetic causes, one, there is environmental causes. Okay. So some of the common causes are smoking. So quitting smoking, we keep emphasizing on cancer age. Tobacco chewing. Smoking causes almost 16 types of cancer, including blood cancer. Stop it. Tobacco chewing can cause all varieties of head and neck cancer, which is terrible for the patient. They end up with a lot of suffering. They may live, but they'll have a tube in the nose. They'll have a hole in the, this called a tracheostomy here. Okay, the face is disfigured. That is terrible. Avoid it. Do not take tobacco. Alcohol consumption, reduce it. Do not take. Take your cervical cancer vaccine for boys and girls between 9 and 13. We keep emphasizing not for cervical cancer alone, for penile cancer, for anal cancer, for oropharyngeal cancer, for anogenital warts, for vulval and vaginal cancer. So all these are prevention strategies. Take the hepatitis B vaccine to prevent against liver cancer. Get BRCA test done for women and men who are at high risk for breast, ovary, and prostate cancer. With this, you can prevent breast cancers. You can prevent ovarian cancers. Okay. Prophylactic surgery in those who are BRCA positive. That is, if a lady is BRCA positive, she can get serial MRIs every 6 months or 1 year, or remove her breasts with cosmetic and get implants done, or remove the ovaries to prevent ovarian cancer in those women who carry the BRCA gene. So these are all strategies. Colonoscopy for men or women above the age of 50 years once every 10 years for colon cancer. So all these are strategies to prevent cancer. And this removes some of pap smear, which we forgot. So anyway, that is screening. So mammogram, which is a screening. So these are
Yes.
all strategies in some of your common cancers. We spoke about lung cancer as a commonest, to stop smoking. We spoke about breast cancer, mammogram, cervical cancer, pap smear and vaccine, colorectal cancer, your colonoscopies. Okay, so and head and neck cancer, which is very common in India. So this way, close to 40% of your cancers can be prevented.
And doctor, just to highlight all these screening techniques, I don't think so they are very costly nowadays, or it is still a cost effective.
Not at all, not at all. They are not at all costly. PAP is not costly, mammogram is not costly, colonoscopy is not expensive, and more than the cost, they are widely available.
Hmm.
You can get these done in Adilabad also. You can get these done in Raichur also. Okay, so not that it is limited to only to the few cities, or
Hmm.
it is extremely expensive, or it is out of reach of the population, or they are not validated tests. They are validated worldwide. Okay, so PSA, which is a small blood test, it is not a routine screening. We have discussed this, but in men who have high risk of prostate cancer, they can get it done after 40 or 50, or those who are BRCA carriers. What's it? It's a small blood test.
Yes.
So all these can be done, and this helps in early detection of cancer, in preventing cancer, and obviously it is going to save lives.
Yes, doctor. It's like uh, uh, pre-detection helps the patient to live for a longer life.
Correct. True.
I know, doctor, you have already addressed some of the screening techniques, but just on a briefer, right? What are the screening techniques available in the cancer which can
So
address?
again, which we keep emphasizing on cancer, is screening is a method to diagnose a disease early in a general population. It
Hmm.
should be accurate, it should be reliable, it should be reproducible. That is, the same test if you do in Kashmir or Kanyakumari also, it should have the same kind of results. It is not that it pertains to a geographic area. Okay, and it should be widely accepted by the local population.
Mhm.
Okay, something which is not native to my country, if you ask me to come and do, I'm not going to accept it. Anyway, it is for the betterment of the individual or the society at large. So for PAPS, for cervical cancer, pap smear is advised every 3 years for women above 21 years, or a PAP and a HPV is recommended every 5 years. For breast cancer, mammogram for women above 45 or 50 every year. For BRCA carriers, maybe an MRI should be added once a year, MRI of the breast. Colonoscopy once in 10 years if you're above 50. So these are the common screening recommendations. Low dose CT scan for heavy smokers. That is a screening methodology for lung cancer. But the better way for a country like India is stop smoking. Why do you want to smoke 2 packs a day and do a CT scan every 6 months or 1 year to find a tumor? So you want to smoke, you want to get a tumor, and then do a scan to find it early and get it treated. The common sense, if common sense prevails, you would rather stop smoking and stop the cancer. Excuse me.
Automatically, the tumor will be also avoided if the smoking is stopped.
Again, to emphasize, 50% or 40% of patients today who come with lung cancer are non-smokers.
Hmm.
Okay, that could be due to air pollution or other factors. That's a topic for a different day. Earlier, we used to see a lot of smokers with lung cancer. Now we see equal proportion.
Hmm.
But even if we are able to reduce this 50% of smokers, heavy smokers who will not develop lung cancer tomorrow, and other 15 types of cancers, including blood cancer, bladder cancer, prostate cancer, stomach, we have gone a long way. And rather than doing a low dose CT for one part of for one cancer which is caused due to smoking, now what are the other screening we are going to do for the other 15 cancers? None. So as well, don't smoke, and kind of be reassured that you're going to do well.
And actually, doctor, if I'm not wrong, many of the in the news I have read a survey that the smoking smokers has came down. Like many people have started taking awareness, whether it is right or wrong.
So see, that depends on the kind of survey which people do and all that.
Yes.
But if you look at general trends, I think when the society is going from a developing to a developed stage, smoking will increase.
Yes.
Awareness has to get it down.
Yes.
The urban population smokes in a different way, the rural population smokes a different way. Two. Three, a lot of women are smoking in India now.
Hmm. Stop.
Again, it is not a question of gender equality. Smoke, a woman getting to smoke no way makes her equal to a man. And it is not necessary. That doesn't mean that men should smoke. None should smoke. So these are the things. And a lot of other smoking devices in the form of e-cigarettes or vaping or
Mm.
whatever they call it, that is on the rise. And that is not safe either.
Yes. In fact, sir, when you are talking about the equality, a man should stop smoking and come to the equality of non-smoking zone.
Correct.
That will be a
No, we should have
friendly.
a smoke-free country.
Uh,
I think I have told this or we have discussed this. We cannot afford, our country cannot afford this high burden of cancers in the long run. Then what will happen is cancer treatment will remain the prerogative of only the elite or the upper middle class. The lower middle class will really suffer because the government cannot take care of your health needs like this. You cannot smoke BDs, develop lung cancer, and be a poor laborer and expect the government to take care of you. I'm not saying that because you're a laborer, the government should not take care. No, a rich guy can smoke and get away because he can take a chartered flight and go to US and get a surgery done for lung cancer. You and me cannot do that. So better do not smoke. And this country still we are battling with malaria. One rainfall we get dengue cases. We have understaffed hospitals, corporatization of culture because of which the expenses are too high in corporate hospital. The government hospital, we don't have the facilities. We have a mix of communicable, non-communicable diseases. We are the diabetes capital of the world. Our stress levels are too high in the young population, hypertension, heart disease, over that infection, tuberculosis, malaria,
yes.
dengue, and then cancer. We cannot, and for our, we being the number one population in the world today, we should find ways to reduce diseases in our population rather than find new ways to get new diseases and invent it.
Very truly said, doctor. Very truly. This is a very important message for everybody that, as doctor rightly said, we are the number one in population, if you can say the number one country in population, and there are many chances of getting disease. So we should spread awareness and work in such a way that the disease are also reduced, or else we are not infected to those diseases. So don't call smoking and get cancer. So this is
Yeah, and
something of
I'll just
very
add one small point. See, from the financial point of view, 30 years back, when you worked in a government sector, you were given a pension, you were given a provident fund. Now, I think post 2002 or something,
Hmm.
the government nobody gives, private anyway nobody gets. So, if I'm a retired guy, I'm 70 today, if I develop any disease, I still have a good pension and the government is going to take care of me and all that. Imagine somebody like me today who retires at 60 and at 70 I get any cancer or any ailment. My savings are all gone. No pension, no PF for my health. So that is why the old saying, health is really wealth. So in our country today, 20 years later, if we all get sick, we are done. We need to have good amount of savings
Hmm.
to take
Yes.
care, number one, and good medical insurance, what that basically means.
Yes.
Number two, on the flip side, imagine I get sick now. I smoke, I take pan masala, gutka, and I give up cancer. What happens? Okay, you may probably treat me, do a major surgery and all that, but I'm out of work. I'm the sole earning member. My family suffers.
Yes.
My family has to sit with me during my chemo sessions, surgical sessions, radiation sessions. So much. So that is what is called out of pocket expenditure.
Yes.
Patients spend from out of pocket to get treatment done. And
Hmm.
sometimes it is called catastrophic expenditure. Catastrophic expenditure means you are spending almost 20% of your annual income on your health.
Very true.
So you have some rare disease, unfortunate, fine. It's not your fault. You smoke, you drink, you take tobacco and get all kinds of vices and get cancer. And then you're spent. So the young guy is out of work, the elderly guy cannot pay for his treatment. So we have a sick society. Sick really means sick, unhealthy society, which we don't want. We want a healthy, young, and old society. The youngsters, India has the largest young population in the world, so they should be eligible to work and contribute to the production of the country. The elderly people should be hale and hearty because of good habits during their younger days.
Yes.
Despite this, if we all get diseases, it is unfortunate. We have to handle it. But we cannot solely say that the government of India has to take care, or the government of a particular state has to take care. Then it is also our own moral responsibility.
Very true, doctor. Very true. So instead of investing on the cancer like a disease which we prone to take it by smoking and tobacco eating, instead of that, save the money and we can do so many other
Don't
things.
invest on, don't, it's not investment also. Investment will give you returns tomorrow. Don't spend money on immunotherapy and chemotherapies and radiation tomorrow. Rather spend your resources on pap smear and mammograms,
Yes.
early screening, detection, and preventing cancer and educating people.
Yes. Very true. So, doctor, there is one query from the audience. It is by from Durgesh. Who gets cancer? Anyone can get cancer, although the risk goes up with age.
Cancer, as we all know, anybody can get cancer at any point in time. The risk factors are your age, your family history of cancer, your habits, and all those kind of things. So,
In fact, in brief, doctor, just now you have clarified who gets cancer. The major thing is some youngster who calls to get cancer, like smoking and tobacco eating. Doctor, there is one more query. How does cancer start?
so on a basic level, a cancer cell, one cell goes out of control. So it has certain growth factors, some inhibitory factors. That balance is lost. So the cell becomes one becomes two becomes four becomes 16, 256. It exponentially multiplies. Then it finds way to get its own blood supply. It will take food from your body from within, not in the literal sense, but that is called vascularization or neovascularization. It forms new blood vessels. Neo means new, vascular means blood. It forms new blood vessels to eat food. So that blood only gets the cancer cell the food. From where does it get those blood vessels? It will rather take away your. That's why you become weak. You become, they call it cachexia. You have weight loss, loss of appetite, and etc. It grows at your expense,
Mhm.
and then it has the chance to spread. It goes to the liver, lung, bone, brain, etc. It is called metastasis.
So I guess, doctor, this was well explained. So, doctor, coming to the second question, what are the types of cancer treatment available right now in the market?
Broadly, surgery, radiation, and chemotherapy or medical oncology treatments are either chemotherapy or immunotherapy or targeted therapy, hormonal therapy, oral tablets.
Mhm.
Broadly, surgery is operation to remove a tumor. Radiation is a treatment given to control the tumor. It may be given after surgery, or it is given to control pain when the tumor is present there, or it may be given to prevent recurrence that the tumor should not come. Chemotherapy, immunotherapy are all different kinds of medications. They are either given in the stage 4 setting or they are given to cure. So these are all the broad kinds of treatment available for cancer.
Doctor, what are the new advances in cancer then?
So the new advances in cancer are from diagnosis to treatment. So one, what are the new advances is we know what all to do for prevention and for screening, etc. May not be new advance, but see the advancement is rather we know we have a cervical vaccine. We know there are tests like a
Yes.
mammogram. Okay, this low dose CT has come. It's
Hmm.
not new; they're all been there for quite some time, but these are all advances. This is in the prevention and screening. In diagnosis, the advances are, for example, a PET CT scan, the MRI scans, the sentinel node we call it. That is in breast cancer, the tumor goes from the breast to the lymph node in the armpit. The first lymph node is called sentinel node. So earlier we used to remove all the lymph nodes and patients used to come up with a swollen arm. Now they say they put a blue dye into the first lymph node. If that is not involved, they don't remove the remaining nodes. So the patient is spared of those complications. Only if the sentinel node is involved, they remove the other nodes. So that is an advancement. These are all surgical technique. There is something called HIPEC, hyperthermic intraperitoneal chemotherapy done in some forms of abdominal cancers. They give chemo during surgery, heated chemo in that it will be put in your tummy during surgery.
Hmm.
It gives better results in some tumors. And finally, radiation, there are terrific advancements which have like IMRT. What does this do? the normal tissue gets less radiation and less chances of side effects. And coming to medical oncology, which is my field, the advances have been in chemotherapy. In what form? Uh, Chemotherapy used to cause so much vomiting. You have excellent medicines for preventing vomiting now. Chemotherapy used to cause fall in WBC counts. Now we have growth factors to prevent fall in WBC counts. That is called supportive care. So when a patient is not vomiting, when he has no fever, when no infections, they feel okay. I can take this treatment.
Yes.
But if you give me chemo and I'm consistently vomiting 10 times a day, I would not like to come for the next session. And immunotherapy is a big advancement. We have discussed that. And then see, in tumors like CML, in these cancers, blood cancer like CML, we have come to imatinib, no more interferons. In a disease called GIST, which is a tumor in the abdomen, where people used to give chemo earlier, it used to recur, no good results. Imatinib, single tablet, does wonders. Maybe some cases, short duration, some patients don't do well, but these are the standards. So this is called TKI, tyrosine kinase inhibitors. In kidney cancer, we don't give chemotherapy now. In certain breast cancers, chemotherapy is not required. Hormonal therapy is required. We give medicines called CDK4 inhibitors, which are tablets. So in breast cancer, we have moved away from chemo, not completely, but yes. In kidney cancer, we don't give. In liver cancer, we don't give chemo. We give immunotherapy, targeted therapy. So, chemotherapy advancements, immunotherapy advancements, oral medication advancements, supportive care advancements, these are all the advancements we have seen over the years.
Wow, doctor, with so many advancement, obviously the side effects and the additional, like the hectic taking so many tablets with so many of taught, I won't say, but everything has been reduced, doctor. Like the side
Definitely,
effects
definitely.
and
The quality of life now for a stage 4 breast cancer or for a stage hormone positive breast cancer or for stage 4 lung cancer who is EGFR or ALK positive is excellent. They take a tablet, sit at home, come once in 3 months to the OPD, once in 6 months, get a
wow.
scan. Average live beyond 4 or 5 years also. And no side effects of chemo, no hair fall, no loss of appetite, no vomitings, etc.
I don't know, doctor, whether I'm right or wrong. It's like every day a thyroid tablet, every day like a BP tablet. So
Very
even
much, very much
cancer,
like that. Very much like that.
yeah. So then cancer can be also in just small little bit of medication can live
Just
a
giving you
good
one
life.
small example.
Yes.
Today we are in 24. So we had one gentleman in 2015. He is 32 now. He must have been 25, 26 then. He has CML, chronic myeloid leukemia, blood cancer. Everybody will treat him the same way. So he is on imatinib, 400 mg once a day. Not that we have done something great. I'm just telling you what is happening. That fellow every year goes to Shabrimala.
Huh.
He walks up the mountain, which is around four and a half
Oh,
kilometers, barefoot,
yes.
comes down. That itself is a task. Again, this is not
Yes.
to promote a religion or whatever. I'm just saying the physical endurance part. Blood cancer patient walking 4.5 kilometers barefoot. Okay. And 2 years back, he has walked all the way from Hyderabad barefoot
Hmm.
for a span of 40 days or 50 days.
Hmm.
Hats off to his physical endurance and his mental toughness. But what I'm trying to say is, can we imagine a blood cancer patient? If he was a regular blood cancer patient, can he go there? He has to come every time
Yes.
for
Not possible.
chemotherapy. He cannot miss his appointment. Now, take a pill, do what you want. What I'm trying to say is, the medicine doesn't cause much of side effects, and it is the best treatment available. That's it.
Even doctor, just the example which you have given, nowadays many of healthy people are also not so strong to walk from Hyderabad to Shabrimala, and that if I'm not wrong, it's in winter season,
And
so
there,
it's very cold. So even the normal healthy people won't dare to do that.
no, no. I go, I don't dare, I cannot dare to.
It's very difficult, sir. 40 days walking 4 kilometers itself is a challenging in Sabrimala climbing that mountain. But anyhow, that's really
So
great.
many of our Mohammedan patients fast during Ramzan. Many of my Christian patients they fast during Lent when there are all kind of medical. I'm not promoting fasting here. No, I'm not saying that. What I'm trying to tell you is, so can you fast? This is common sense. Can you fast when you're on chemotherapy and when you're vomiting and all that? No, right?
Mm.
So that means there's an alternate medication which is better than chemotherapy, which allows you to do these things also, and you have good quality of life and disease is under control. That's the whole point.
That's actually a real advancement in cancer,
from a
doctor.
patient point of view.
That's really good to know. Then, doctor, what is the future right now for?
The future is bright. We have to have hope. But we have to educate ourselves. We have to go back to basics. Let us not go into hi-fi things like what is the latest immunotherapy which has come, which can improve the life of a person by maybe 20 days or 2 months. So that is for patients who have extensive disease. Why do we have to go for extensive disease also? Can we prevent the disease? Can we screen? Can we be disease free? That is what we should concentrate.
Doctor, there is one more query from the patients. He is asking, is cancer contagious? And is there any vaccine available for cancer?
We have discussed these four vaccines, we have told multiple times, and cancer is not contagious.
That is something even I am shocked. How can cancer be a contagious? It's a mutational defect happening in the patients or sometimes genetical. Doctor, he is asking, what are the stages of cancer and what do they mean? Actually, to this, doctor, you have answered many times.
So, very simply, briefly to this gentleman, early stages disease is confined to that particular area. Advanced stages, it spreads beyond and it goes to other organs. And if it's in the vicinity, it is called locally advanced. That is what we should understand. Early, locally advanced, and advanced.
And doctor, he has a same continuation question that does cancer have any symptoms?
Yes, multiple symptoms which we have discussed
Yes.
earlier, which can be systemic symptoms in the form of extreme weakness, fatigue, weight loss, loss of appetite, or general symptoms pertaining to one organ. If it is lung cancer, cough, chest pain, breathlessness. If it's CNS tumor, headache, vomiting, for weakness of limbs or seizures. If it is a liver cancer, maybe jaundice or pain. If it is a stomach cancer, vomiting continuously or difficulty in swallowing and weight loss, so on and so forth. The breast cancer, lump in the breast, cervical cancer, bleeding for women, uterine cancer, postmenopausal women presenting with bleeding. That is, many women who have finished, who have attained menopause, they develop sudden onset bleeding.
Anyhow, doctor, in depth, you have explained in your previous videos that what are the symptoms and treatments of different cancer. So that links are already available, which he can refer and he can
Correct.
get more
Correct.
in-depth details. So, doctor, by this, we have came to an end to our exciting session about the world awareness. As you rightly said, doctor, there is one message which even I am going to register in my mind is not only February 4th, but remaining 364 days should be, I should say that it should be a world awareness days. In fact, it should be a world awareness knowledge, which should be spread everywhere, across the India as well as world if possible, doctor. Thank you, doctor. Thank you very much for sharing your amazing message on this World Cancer Day. Doctor, would you like to give some closing comments to this World Cancer Awareness Day?
One simple thing, close the care gap. That's it. Let us just do that this year. I think we have achieved our motto.
Yes. In fact, doctor, wishing that remaining days, everybody will work on closing the care gap, doctor.
Perfect.
That will be the best message, doctor, given by you. Thank you, doctor. Thank you very much for today exciting awareness session to the people and as well as for me as well. And thank you everybody for joining us today. So wishing you all strength, hope, and good health from Cancer Rich, and also quit smoking, stay away from tobacco, and stay away from alcohol.
Thank you. Thank you so much.
Thank you, doctor. Thank you, everyone.